Hi, I'm Dr. Gayathri, physician Changampally Remedium. Here we are back with another case discussion. Today we have Dr. Vismaya, an Ayurvedic surgeon, Changampally Remedium with us. Today we are going to discuss on astrocytoma, which is basically a type of brain tumor. So doctor, can you please give a brief description about what is exactly astrocytoma?
Astrocytoma is a neoplasm of the glial cells, which are the supportive cells of brain and the nervous system as such. Any growth pertaining to that type of cell can be considered as astrocytoma.
So doctor, what are the mainly seen or the usually observed clinical presentations or the symptoms of the case?
Okay, the signs and symptoms depend on the area in which the neoplasm occurs. So it is because of the pressure effect of a growing tumor. But in clinical practice, what we usually observe or the patient in majority tells us are altered mental status, cognitive impairments, headaches, vomiting, seizures, and sometimes there will be sensory anomalies or difficulty to speak. And on physical examination, we usually examine the cranial nerves, right? There may be anomalies in that, or there may be hemiplegia.
Okay.
So these are the symptoms which we usually observe.
Okay. So, doctor, in consideration with the present cases we are going to discuss, can you please give a brief description on the history of the case scenario along with the clinical presentation which were observed during the case?
Okay, one case which is there, which was recently dealt with, was a 19-year-old male. And the history goes like he was coming back from school with his friend, and when he was supposed to get down on his stop, he just stood in the bus blankly. Okay, that was the history told. And when he was taken to nearby hospital, they did an MRI brain, and it was confirmed that he was having astrocytoma. Okay, and the position was frontal lobe.
Okay.
Then he was advised to do surgery, followed by chemo and radio. The first surgery took place, the patient was perfectly fine. After 2 months, again MRI was done. Again there was
a recurrence.
Okay. And he underwent the second surgery, and after the second surgery, there was weakness of his left side of the body. Okay. Then after even in that condition, he underwent with the chemo and the radiation. Then the next incidence was 6 months after this surgery, when the chemo and radiation was going on, and the patient didn't want to undergo further surgery, so he consulted us and he got admitted.
So what about the second case?
In a second case, the patient had first occurrence of the weakness of limbs, both upper and lower, and he was having seizures. Okay, so he also underwent multiple surgeries, post chemo, post radio, and then got consulted. And at the time of consultation, he was having the same complaint. He was having seizures associated with weakness.
Okay, so both of the cases were effectively managed.
Yes. We give external therapies, detoxification therapies, as well as oral medication. Of course, the treatment varies based on the patient, but the basic principle remains the same. And in all the cases which are being dealt in our hospital, the effect was satisfactory.
So what was the exact Ayurvedic approach you guys opted for the case?
That's what external, yeah.
Okay, doctor.
Okay, that basically we can say that in all the cases, if we are taking as a whole, there was Snehapana Virejana, Basti treatments, Nasya treatments, Shirosega, what we say, Shiro Dhara, and Talabudiche.
Okay, doctor.
Okay, and oral
so
medication
all
depends.
The Rasayana therapies were opted.
Yes.
Okay, doctor. So after the treatment, like what was the exact result you obtained or the outcome? What was the outcome of the treatment?
See, the general condition of the patient was significantly improved. There was no episodes, that is one, seizure, the episodes of seizure was either significantly reduced or absent, and the patient, like bowel, bladder, appetite, sleep, everything was normalized.
So the quality of life was very much improved after the treatment. So everyone will be having the question like, was there any kind of adverse effects or the complications after the treatment that you have been
See, in
observed?
any sort of treatments, it is very important to be very careful to avoid any complication, whatever it is. Even if you are doing a panchakarma therapy, also we should be careful to avoid complications. And if that is kept in mind, other than that, we have not observed any such adverse effects in any of our patients.
Okay. So I think it might be clear to our watcher, like the viewers also, because everyone knows about brain tumor, but a coin term like astrocytoma is a difficult term to understand and to realize what it is actually. So I think this would be a valuable session. Thank you so much, doctor.